I was having this narrowing of the heart valve for some time, and it was giving me problems.
So Bob had severe symptomatic aortic stenosis. He had a very tight valve, and essentially your normal aortic valve is supposed to open and close every single beat throughout your life. His valve was basically opening up, even a little bit tighter than this. So he really had no blood flow going out of his heart, and so most of his blood ended up on his lungs, causing shortness of breath and really causing him to pass out because he wasn't getting blood to his brain.
My daughter tried to get me in at Mayo, but the list there, it's a big place. I was there for 2 days for examination, and I never heard anything, so she called Bellin, and Bellin nurse said, "Have your dad come in."
The valve team at Bellin really made this possible, and I was part of the initial trial in San Diego called the Partner Trial, and when I was looking across the country for a place to work, I looked at the team that was present, and we have some of the most innovative surgeons here, and we have a group of cardiologists who are very open to new technology and being able to help their patients who had no options before. So we really developed a team of really 20 to 25 people where we come together and find the right answer for the patient.
I met Dr. Hudson, who had just came to Bellin, and he examined me and he said, "You'll be a good candidate for this type of surgery." So about a week later, I had the surgery, and I had a lot of confidence in Dr. Hudson. I didn't even worry about having it done.
Bob is really a phenomenal individual, both as a family man, but also being able to have the courage to be the first valve replacement using a transcatheter route in our region. He knew that he was number one, and he wanted to be number one. I think that is one of the most admirable things that I've seen.
I had a nurse that stayed with me the first day, all day. It was just in my room, so I thought that was very nice. He just babied me. And in fact, he followed me to the next, after I got out of intensive care, he just come to see how I was doing. So staff was very nice.
Usually it takes somewhere in the range of 4 to 6 months to fully recover from a valve replacement through open heart surgery, as opposed to 1 to 2 months for a stent valve that's being placed through the groin artery through the side of the chest. So the recovery time is definitely quicker, and so that's a definite benefit towards that procedure.
I don't have any shortness of breath, and I don't feel oozy, kind of lightheaded like I did before. So it's a big improvement.
So Bob is now doing everything that he wants to do, which is an amazing thing at 90 years old. He was really unable to do anything at all when he had his severe symptomatic aortic stenosis. He would pass out, bump his head, he would be short of breath, and now he never has to worry about those issues.
That's a good feeling. My wife feels good about it.
This is a whole new world of being able to treat patients who we had no options for before. We have patients like Bob who really were told to go home, don't do much, and live your last couple of years completely restricted. That's not the way I see things ending for a patient who has done so much throughout their life to live the right way. And so for me, it's really a passion to give these patients an option when they have no options before.